Welcome to UCSI University 19th Annual Public Health Campaign 2021. This cancer information video, which is entitled Colorectal Cancer, will discuss what is colorectal cancer, the risk factors, signs and symptoms, screening as well as the prevention of colorectal cancer. Do you know what colorectal cancer is? Colorectal cancer usually develops from non-cancerous polyps in the inner wall lining of the colon or the rectum. These polyps can turn cancerous over time, and they can spread through lymph or blood vessels to other sites. Hence, early detection is important to remove polyp before it turns cancerous. There are various risk factors of colorectal cancer. The history of inflammatory bowel disease, namely ulcerative colitis or Crohn's disease, increases the risk of colorectal cancer. Next, family history such as first-degree relatives have a higher risk of colorectal cancer in their lifetime. First-degree relatives include their parents and siblings. Besides, genetic predisposition is also one of the risk factors. For instance, history of Lynch syndrome and familial adenomatous polyposis (FAP) are more likely to develop colon cancer. Moreover, obesity and physical inactivity results in a higher risk, as a high body mass index (BMI) indicates a greater chance of developing colorectal cancer. Next, alcohol consumption and tobacco use increase the risk of colorectal cancer as well. Furthermore, an unhealthy diet, namely high intake of saturated fat, processed meat and red meats, and a diet low in fiber, folate, fruits and vegetables can increase the risk of colorectal cancer. The signs and symptoms of colorectal cancer include change in bowel habits such as diarrhea, constipation, or alteration in size or shape of stool that lasts for days. Persistent abdominal discomfort, namely frequent gas pain, bloating, feeling of fullness or cramp, may be experienced as well. Abdominal pain and tenderness, like feeling sore or ache in the lower abdomen, may also occur. Besides, rectal bleeding appears where blood may be observed in the stool. Over time, the blood loss can build up and lead to low levels of iron in the red blood cell, also known as iron deficiency anemia. Moreover, weakness, fatigue and unintended weight loss may result, in which the patient will feel weak and constantly tired. Some people may experience jaundice, where yellow discoloration of the skin and eyes may be seen. Therefore, kindly check with your doctor if you have any signs or symptoms as mentioned above. Regular screening is recommended for those aged 50 years and continues until 75 years old. Screenings of colorectal cancer available at the hospitals or health centers include the fecal occult blood test, FOBT, which is used to check for blood in feces. Next, sigmoidoscopy uses a flexible lighted tube with a lens inserted into the rectum and sigmoid colon to observe the colon lining. Furthermore, colonoscopy uses a flexible lighted tube with a lens inserted into the rectum to examine the entire colon lining. There are several ways to reduce the risk of colorectal cancer. Maintaining a healthy body weight is one of them. This is because exercise reduces the likelihood of being overweight and obese. Hence, regular exercise helps to maintain a healthy weight. Active living and healthy BMI reduce the risk of cancers as well. Besides, long-term smoking is linked to an increased risk of colorectal cancer and other health problems. Quitting smoking may help lower your risk of colorectal cancer and many other types of cancer, too. Moreover, no alcohol also aids in reducing the risk of colorectal cancer, as alcohol consumption causes cancers of the mouth, throat, pharynx, voice box, larynx, esophagus, liver, and colorectal organs. Next, reducing fat intake aids in decreasing the risk of colorectal cancer. This is because intake of dietary fat stimulates the release of bile acids. High levels of bile acids are associated with bowel mucosal irritation and cell multiplication responses, which may promote tumor growth and increase the risk of colorectal cancer. On the other hand, increasing fiber intake also reduces colorectal cancer risk, as insoluble fiber reduces the exposure of the intestine inner lining wall to carcinogens. Fiber that is contained in vegetables, fruits and grains reduces the oxidative damage to DNA and enhances the DNA repair processes. Furthermore, Reducing intake of red and processed meat results in a lower risk of colorectal cancer as well. Overcooked red meat contains cancer-causing substances called carcinogens, whereas processed meats such as bacon, sausage, lunch meats, and hot dogs contain preservatives. If red meat and processed meat are consumed frequently, these increase the exposure of the colon and rectum to carcinogens, thus, increasing the risk of colorectal cancer. Thank you for watching.